Equine lameness has always been a significant concern in veterinary medicine and the equine industry. It impacts a horse's athletic performance and overall quality of life. Treatments such as stem cell therapy and extracorporeal shockwave therapy aim to improve recovery outcomes and reduce rehabilitation time. Research into these areas is driven by the need for effective treatment options and a deeper understanding of lameness prevention. Examining these topics aims to provide a clear overview of the current state of research and identify areas for future study. A stem cell is a cell that has not gone through differentiation, meaning it can become many different types of cells. Another key characteristic is that they can divide quickly. Stem cells also affect the immune system, allowing them to decrease the inflammatory response. There are multiple types of stem cells, but when used in therapy, veterinarians focus on the M stem cells, specifically for regeneration and replacement of muscles, tissues, bone, cartilage, tendons, ligaments, and more. Overall, in therapy, stem cells can regenerate and replace tissue. Stem cell therapy is extremely effective in treating tendon and ligament injury in horses. In many cases, it allows the horse to return to its previous competition at a full level. It is most useful when treating tears, but it is not effective if the injury is a complete rupture. One of its major advantages is its low-risk nature. There is no risk of rejection of the stem cells because they are derived from the animal's own body. In essence, stem cell therapy takes advantage of the natural healing biology of an organism. 75% of animals can return to their previous competition or activity level after stem cell therapy. An article, Canine Stem Cell Therapy, by Joni Osborne, says explicitly that stem cell therapies are particularly useful when treating tendon or ligament tears, but do not have enough material to heal complete ruptures. Extracorporeal shockwave therapy creates acoustic pressure waves that can be focused and applied to one body area. The exact mechanisms of therapeutic action are unknown, but they are thought to include direct stimulation of healing. Becker 15. The article by BEVA mentions that the physics of shockwaves is a rapid increase of pressure followed by a quick decline to negative pressure. Electrohydraulic electromagnetic mechanisms generate extracorporeal shockwaves. These all allow extracorporeal shockwave therapy to be focused on one spot. Extracorporeal shockwave therapy can be beneficial to the healing process of horses. It can decrease healing time and fill in defects in tissues. To also consider, limited studies have previously been performed using this therapy. Case studies have no control variable and are almost always used with other treatments. This makes it difficult to determine to what extent extracorporeal shockwave therapy was beneficial. The therapy has the potential to be a favorable one when used correctly. Protocols determining energy settings, number of pulses, and more have not been determined in an experimental setting. More research needs to be done on this therapeutic practice. When extracorporeal shockwave therapy is administered with stem cell therapy, it presents positive results, specifically a higher proliferation rate, increased growth, and differentiation in kinases. Dr. J.C. Theike from Anoka Equine in Minnesota states that there are no drawbacks when it comes to extracorporeal shockwave therapy. It is most effective when soft tissue and bone meet, and when insertions or origins of tendons and ligaments occur. He mentions that it is less effective when applied to the mid-tendon or ligament. However, excessive extracorporeal shock waves show the possibility of increased cell damage and cell death. It is not recommended continuous parallel use with local stem cell injections. The conclusion of the study highlighted in BEVA showed that it is not recommended to administer extracorporeal shockwave therapy on normal tissues in horses, and technicians should instead focus on the region of injury without moving into normal tissues. Stem cell therapy is a highly effective treatment for tendon and ligament injuries. With benefits in both safety and healing capabilities, extracorporeal shockwave therapy, while beneficial in some cases, lacks conclusive long-term data due to the frequent use of combined therapies and limited controlled studies. While therapeutic options like stem cell therapy and extracorporeal shockwave therapy show promise, further research is necessary to determine treatment protocols. Overall, due to the widespread of different options when it comes to extracorporeal shockwave therapy, stem cell therapy might be a better option for you and your horse. This being said, the therapies have slightly different goals, so it is important to speak with your veterinarian about what is right for your horse.